When choosing a licensed producer, it's important to make sure that they have the product that you and your physician feels is right for you. It's also important to ensure that if you do sign up with them, they'll be able to consistently supply you with your medication. If you and your doctor decide that herbal cannabis is right for you, and you get a prescription or medical document for herbal cannabis, hopefully you and your doctor will discuss the ratio of THC and CBD that might be right for you. Some patients need one type of cannabis that is high in THC. Another patient might need a different cannabis that's high in CBD. Another important question to ask a potential licensed producer is in what forms they make their product available. Prior to summer of 2015, the only way that licensed producers were able to supply their product was in the dried plant form. As of this summer, licensed producers are able to provide extracts such as oils and other derivatives. If you are interested in using herbal cannabis that is not only in the dried plant form, make sure that the licensed producer that you're thinking of signing up with is able to meet your expectations. Another important consideration when choosing a licensed producer is the cost associated. Medical cannabis is not usually covered by public or private insurance plans, and because of that, it's an out-of-pocket expense. Every company has their own pricing policy, and every company also has different price reductions for people who are on various disability or social assistance plans. It's important to ask the licensed producer that you're considering signing up with whether they have a pricing plan that is acceptable to you, to make sure that you'll be able to afford your medication if this is a medication that will be working for you. Once you and your physician have decided that medical cannabis is right for you, your physician has to fill out a prescription, but in this case it's called a medical document. It's filled out in terms of how many grams a day you are entitled to receive and for what length of period. The medical document can be for any length of period up to 1 year, and that decision is made between you and your physician. A typical medical document will usually last 3 to 4 months. This is to ensure that you will go back and see your physician will monitor your progress while being on this medication, and to adjust the dose as well as the potency if necessary. Medical documents will often specify the maximum percentage of THC that you are able to receive, and this may need adjustment at every visit. Along with the medical document, you also have to submit an application package. The application package has your personal information as well as payment information that you need in order to pay for the product that you will be receiving. The medical document can be submitted either by yourself directly to the licensed producer by mail, or it can be submitted by the family doctor or your specialist on your behalf. After your medical document and registration package has been submitted to the licensed producer of your choice, you will be registered with them. If you don't hear from your licensed producer within 1 week's time, please call the licensed producer to find out the status of your application. At that point, you can start making your first orders and receive your medication. You will have to speak with a customer service representative at the licensed producer that you have signed up with, and they will help guide you through the selection process and help you make your first order. Your first order should typically arrive within 1 week's time. Typically, it will arrive in a sealed package, smell-proof, as well as no markings so that your neighbors or postmen won't know what is inside the package. This is important to protect your privacy. When patients first receive their package of medication, it usually has several medication bottles, just like you would receive from the pharmacy. What's different is that these medication bottles don't contain pills or capsules. It contains dried cannabis. When you receive your herbal cannabis, it's in the dried plant form. The question is, how do you consume it? There are different ways that you can consume herbal cannabis. The typical way is by inhaling it. You can either inhale it in the smoked form, or you can use a machine called a vaporizer. A vaporizer is thought to be a much healthier and less dangerous way of inhaling herbal cannabis. Smoking cannabis in any form, whether it be in a joint or a bong or a pipe, is very bad for your lungs. We recommend against smoking cannabis in any form. There are, however, advantages to inhaling herbal cannabis. Inhaling herbal cannabis allows you to adjust your dosage much more easily, and it also allows you to experience the effects much more immediately. That is why we often recommend vaporizing as opposed to other methods of ingestion. There are a number of ways that medical cannabis can be ingested, either in the herbal form or through derivatives such as oils. This can be discussed with your physician, and an appropriate plan can be made for you. Just like any medication, your doctor will be seeing you on a regular basis to make sure that what has been prescribed to you is being used, to monitor its effectiveness, and to see if you've been having any negative reactions to the medication that you're using. If you do notice any negative reactions to this medication, either physical or psychological, it's important to notify your healthcare provider. At the conclusion of your first prescription for medical cannabis, you'll see your doctor in follow-up. This will be in order to review the effectiveness of treatment and to determine whether you will want to proceed with this treatment going forward. If this medication is having negative side effects, or if it's not doing what you had hoped it would be doing, then it may not be worthwhile continuing. If you do decide to continue, then you will have to renew your medical document and make a new application for a licensed producer. If you do decide to continue with this treatment, you may have to adjust the dosage, you may have to adjust the potency, or the CBD to THC ratio that you have been purchasing from your licensed producer.